We will review a number of potential issues encountered with the equipment. These include the unit will not turn on, malfunctioning or unresponsiveness of the touchscreen, the vacuum test failed, the fluid path being blocked, demonstration of manual prime, checking the handpiece, and loss of cutting power or occlusion. If the unit will not turn on or does not have power, first check that the AC power cord is properly connected. Check fuses in the AC power input module and replace if blown. Cycle the power switch on the rear of the console off for 10 seconds and then back on. If the touch screen is unresponsive at any time, first, verify that there is no visible moisture or debris on the touch screen. If necessary, clean the screen with a very small amount of 70% isopropyl alcohol applied to a soft cloth to remove the moisture or debris. Close the screen to the horizontal position and then reopen and turn the system on. If you receive the message "Vacuum test failed, prime again," verify that the cartridge is properly installed and securely locked into place. Make sure that the needle cap is secure and check that each tubing connection is correctly installed and secure. Verify that there are no visible leaks at each tubing connection and the needle cap. Make sure that the inflation cuff has maintained pressure during the priming cycle. Once these items have been checked and verified, press the Prime button to initiate a secondary priming cycle. If you receive the message "Fluid path blocked, prime again," verify that there are no visible kinks in the TX1 micro-tip tubing. Deflate the inflation cuff by disconnecting the air fitting from the console. Depress the cartridge release button on the console and remove the cartridge. Verify that the peristaltic tube is centered within the two grooves on the cartridge. Reinstall the cartridge and inflation cuff into the TX system console. Depress the foot pedal and listen for the irrigation pinch valve operation, click, and air pump operation. Press the Prime button to initiate a secondary priming cycle. If these steps are unsuccessful, perform a manual prime by completing the following steps. Cycle the power switch on the rear of the console off for 10 seconds and then back on. Select irrigation on, aspiration high, and cutting power off. Select coagulation off if featured on your console. Depress the foot pedal until the inflation cuff is tight around the irrigation bag and the needle cap is filled with irrigation fluid. Select cutting power low, medium, or high, and depress the foot pedal to test ultrasonic power. If you receive the message "Check handpiece," that means the console has detected an electrical connection issue between the TX microtip and the console. To troubleshoot, first ensure that the microtip electrical connector is properly inserted into the console cut receptacle, making sure the recessed arrow or red marker on the connector housing is aligned with the red dot on the console. Remove and reinstall if unsure. If you confirm the microtip is properly inserted and you still do not have cutting power when the foot pedal is depressed, check for a faulty or damaged TX microtip. Second, confirm that the foot pedal is properly installed on the back of the console. For a console with the coagulation function, ensure that the coag setting has been set to off. Replace the TX microtip if these steps are unsuccessful. An audible alarm or beeping sound followed by a loss of cutting power means the console has detected an occlusion or blockage of the aspiration line at the microtip needle. Adjust the aspiration setting to provide more fluid to the surgical site. Completely depress the foot pedal for 3 to 5 seconds and release the foot pedal. This will help to dislodge the blockage from the microtip needle.